All right, this video is going to be talking about medication and medication administration, the steps that we're going to be taking prior to giving our patient medication, and what medications that will be given to these patients. So now we're looking at routes of administration. We have multiple different routes. You'll be using medications via sublingual, like nitro under the tongue, or orally aspirin, getting the patient to chew it up and then swallow it. You'll use inhalation with albuterol. They'll be getting nebulized treatments. Intramuscular, that is going to be whenever you're using that EpiPen um, and doing the administration in a patient's thigh. You guys don't really do a whole bunch of subcutaneous, but in certain situations you may be able to do subcutaneous injections. And then last but not least, intranasal. That's going to be when we're giving our patients Narcan using a MAD device to get a nice spray over the mucosal membranes. Other things that I want you guys to kind of take a look at is look at the chemical and generic names of the medications. That way, whenever you're seeing the different versions and different names of a medication, you know exactly what that is. For instance, naloxone is Narcan. Naloxone is going to be the generic name, whereas Narcan is going to be the trade name that's specifically given by the company. Also, take a look at the different forms that medication comes in, like in a pill form or in a suspension or liquid form. Make sure that you're familiar with that and all the different medication administration devices like syringes, auto-injectors, and Bristol jets. Just make sure that you go ahead and review those and how to use all of those prior to starting to administer medications in class. So, to administer medication to a patient, there's a couple of things that we want to do prior to giving our patients medication. One of those is going to be obtain an order. Most of the time, we'll have written protocols that we're going to follow. So that's how we're going to get most of our orders. But on occasion, you may have to reach out to medical control to get a direct order from them. Make sure that whenever you go in your bag, you're grabbing a proper medication. Make sure you read the label and check it twice. We don't want to make a mistake and give our patients the wrong medication. Definitely ask about allergies. If they're allergic to anything, even though by the time you're giving medication, you should have done the sample history on your patient. Um, we still want to make sure that we double check about allergies just to be safe. And then we're always going to check the 5 rights of every medication prior to administration. We want to make sure that we have the right medication, we have the right date, as in it's not expired, we have the right dose. So make sure that you go through and learn all the different doses for all of our medications. We'll kind of go over some of that in a second. Make sure it's the right route, like I talked about on the previous slide, and then make sure that it is the correct patient. Sometimes we do have medications that we assist our patients with, so make sure that whenever you're administering those medications to the patient, that you're verifying that that medication belongs to them prior to administration. And last but not least, we need to document everything. We definitely want to make sure that we're writing down the time that we give our medications and how much medication that we gave. The first medication we're going to go over is going to be oxygen. Oxygen is fairly simple. If the patient's SpO2 is under 94%, then we want to be administering these patients oxygen. The only contraindication to it is if our patient has a SpO2 greater than 94. We do not want to be administering oxygen to these patients. Remember, too much of anything is a bad thing. For the dosage, depending on what device you're using to give oxygen to your patient, you're going to switch up the amount of liters per minute that you're going to be giving the patient. So for the nasal cannula, it's going to be 1 to 6 liters per minute. For the non-rebreather, it's going to be 10 to 15 liters per minute. And then last but not least, for the BVM, it's going to be 15 liters per minute. The action is pretty simple. All we're doing is increasing the available oxygen to the patient for their tissues to be perfused, right? Side effects, if you do give too much of it, it can cause increased systemic resistance, right, and decrease cardiac output. This is part of the reason why we do not want to give oxygen if it's not needed. For oral glucose, this is going to be the medication that we're giving to our diabetic patients who are experiencing hypoglycemia. So, first thing to note is that sometimes it's known as oral glucose, glucose, or instaglucose, just depending on who's asking about it. So, like I said previously, make sure that you are familiar with the different names for your medications. So, indication is going to be a patient that has altered mental status and has a history of diabetes, um, and their blood glucose levels are under 60. We will not give this medication to any patient who is completely unconscious or who is so altered that they are not able to follow commands or able to swallow. The dosage for it is 15 grams. It's kind of easy with this particular bottle of glucose to kind of remember because it's glucose 15. So make sure that you are aware of how many grams of glucose that you're giving to your patients so that you can document that. The action is it just increases the amount of sugar that's available in the blood. For this, we want to make sure that we use like a popsicle stick. We want to apply it to the inside of our patient's cheek. This is given buccally, so that it can absorb into those mucosal membranes and get into the bloodstream a little bit quicker. The side effect is that basically that is just delayed. That's the big thing. It's going to take a while for it to get in, and it's going to take a while for it to start working. If you're giving it buccally, like I just said, it's going to kind of start acting a little bit faster. But if your patient's just swallowing it, it can take up to 20 minutes for you to see the full effects of the oral glucose. This is activated charcoal. It has a couple of different names. Superchar, Instachar, Actidose, Liquid Char are just some of the names, trade names that it has. This medication we're not really using much. A lot of companies don't actually have it on the truck anymore, but there is a possibility that you guys will be using it. So you need to be familiar with it because it's within your scope of practice. It is going to be administered for patients who have recently ingested either opioid or anticholinergics or some other type of medication with a sustained release. So we want to go ahead and get this on board. What it's going to do is it's going to bind to that medication and absorb it so that it no longer releases into the patient's bloodstream. We do not want to give this to our patients who have altered mental status or anybody who's swallowed any type of acids or alkalis. We also want to not administer this to patients who do not have the ability to swallow or if they have taken cyanide. The medication is in the form of it is going to be pre-mixed with water. It's like a powder that's mixed with water. It's a total of 12.5 grams mixed in water. And we're going to give our patients 1 gram per kilogram of weight. So the normal adult dose is around 25 to 50 grams. Maybe not so much in Louisiana, but on average, that's going to be the dosage. And then for infants and children, it's about 12.5 grams. So just make sure that you're getting your patient's weight if you feel like you need to administer activated charcoal. Side effects of activated charcoal, we're not really going to see this all the time, but they may have dark or black stool. One that we may actually see is going to be it could cause our patient to vomit. So kind of keep that in mind and be prepared for that if you administer activated charcoal to your patient. This is aspirin. It's a pretty common medication, so it has a lot of different trade names. You may hear it called ASA. You may hear it called Bayer or St. Joseph's. Those are some of the more common trade names. For this medication, we're going to be administering it to our patients who have cardiac chest pain. We do not want to give this to patients who are just complaining of pain, like I have a headache or something like that, and we just give them an aspirin. We're only going to be giving it to our patients with cardiac related chest pain. The contraindications for this is going to be anybody with a known allergy or hypersensitivity to this drug, and then any patient with any type of internal bleeding, like patients who may have an aortic dissection or some type of a GI bleed. We want to hold back on administering this medication to the patient. Maybe reach out to medical control and see what they want you to do in that situation. It comes in the form of a tablet. It's a chewable, and we're going to give between 81 to 325 milligrams. Normally, we're going to take 4 of those 81 milligram baby aspirins and get our patients to chew it up. That's going to give them about 324 milligrams of aspirin, which is very close to our max dose, so we'll be really happy with that. If your patient has already taken their aspirin, like they take a baby aspirin every day, you can still administer all 4 aspirin pills to them. But if they had like literally just taken it right before you came, you can give them the slightly altered dose, but there's nothing wrong with giving them all 4 aspirins at any time. The action of aspirin is just that it's a platelet aggregate. So what it's going to do is it's going to stop the platelets from being able to stick to each other, basically stopping a clot that's inside of their heart from getting worse. We definitely want this because we don't want a complete blockage, because that's going to cause even more problems for our patient. Some of the side effects of it is primarily just stomach irritation, right? So just kind of keep that in mind. If your patients start complaining of an upset stomach after taking the aspirin, that's not abnormal. Just continue to treat the patient and reassure them that that's a normal side effect of the medication. Now we have nitroglycerin. Nitroglycerin is kind of the buddy for aspirin, right? This goes with our chest pain patients also. Sometimes our patients are prescribed this. This is a medication that you will be only assisting the patient with taking. It's not normally carried in your bag because it is an assist medication. The patient has to be prescribed it in order for you to be able to administer it. It also has multiple different names like Nitrostat or Nitrobid. Just kind of keep in mind that it's all still the same thing. As you can see on this bottle, it says Nitro Mist. So depending on the manufacturer, it kind of changes, and depending on what form it comes in, the name also changes. This comes in both pill and liquid form, and it also comes in the form of a paste. Um, but for you guys, you're mainly going to be seeing it in that pill form because that's what's going to be prescribed to the patient. They're going to take that little pill and put it under their tongue. This is the medication that we're going to be administering sublingually to our patients. Contraindications for this is going to be any patient who has a blood pressure under 90 systolic. So we don't want to give it to them because this can cause their blood pressure to drop. We also do not want to be giving this medication to anybody who has any type of erectile dysfunction medication on board or phosphodiesterase medications. Keep in mind that that medication is not only given for erectile dysfunction, but it's also been given for patients who have pulmonary hypertension. That's what they were originally made for, but they found out that it had a side effect that was a whole lot better to market and would make them a lot more money. So keep that in mind when administering this medication. The dose is going to be zero point 0.4 milligrams sublingual, and you can give this medication 3 times, about 3 to 5 minutes apart each. And the action of it is doing vasodilation. So it's going to make that vessel get bigger. So if there's some type of a blockage there and the vessel gets bigger, now blood is able to flow past the blockage and get to the tissues that need to be perfused. Some of the side effects is going to be a headache. Patients may complain of a headache. They may also see a drop in their blood pressure, or they may complain of some burning or stinging around the administration site. That is all normal. Kind of be mindful of that. You may even give your patient a heads up, like, hey, you may start getting a headache after I give you this medication. That's normal. The medication that we're looking at now is going to be our meter dose inhaler and our small volume nebulizer. The medication that goes inside of those is going to be albuterol. We're going to kind of go over these two kind of simultaneously because they administer that same medication. Things to kind of keep in mind with this is there's going to be a plethora of names for albuterol. So with the meter dose inhaler, you have Provental, Venolin, some of the ones that you may see or know about a lot. And then they have other versions that come in a powdered form. And then they have other versions um, that are mixed with another medication called ipratropium. So just be mindful that this medication comes in a whole bunch of different forms and mixtures. The indication for this is going to be our patients that's having difficulty breathing, specifically our COPD or asthma patients that have some wheezing, indicating that they have some bronchoconstriction going on. Contraindications to this is going to be patients with altered mental status. They need to be able to follow commands, right? We also do not want to be giving the meter dose inhaler to patients who they're not prescribed to. So make sure that whenever you're administering this medication that you're looking at the prescription, checking to see whose name is on it prior to administering it to a patient. Sometimes with our asthma patients or COPD patients, they may have like an action plan if they're having an exacerbation of their symptoms. Um, Make sure that you take a look at that because that may change the dosage that they're supposed to get. This is an assist medication, so you just follow whatever dosage that is on the medication or that's on their action plan from their doctor. The MDI, the form is going to be in an aerosolized form, whereas the nebulizer is going to be a liquid form. We're going to have like these little vials of albuterol mixed with water. That's going to be 2.5 milligrams, which is going to be inside of that vial mixed with about 3 cc's of water. And we'll empty that into the chamber and screw everything together and connect it to oxygen to administer it to our patient. The action for this one is going to be a bronchodilation. So, like we talked about a second ago, our patients who are experiencing these breathing problems have bronchoconstriction. So, the way that we fix that is by giving them a beta 2 agonist that's going to cause bronchodilation and it's going to decrease the resistance in those airways and help them get that air and that oxygen down to the villi where they can have gas exchange. Some of the side effects is going to be headache. They may get shakes. They may have a dry mouth, nausea, or a headache. So just kind of keep that in mind when you see that with the patient, that these are normal side effects for this medication. This is our EpiPen auto-injector. It comes with multiple different names, EpiPen, EpiPen Junior being the version that's going to be for pediatric patients, and then Twinject. So make sure that you're familiar with all of those different names. This medication is going to be given for patients showing signs and symptoms of moderate to severe allergic reactions or anaphylaxis that has respiratory distress and showing signs and symptoms of anaphylactic shock. For this medication, the dose is going to be zero point 0.3 milligrams IM injection or intramuscular injection. Um, and then for the pediatric patients, it's going to be 0.15 milligrams IM injection. Things to keep in mind with this medication is that if the patient is greater than 66 pounds, then we're going to give them the adult version or adult dose of the medication, and that the side effects can sometimes be pretty strong with the increased heart rate, possibly pale skin, dizziness, chest pain, headache, nausea, vomiting, or cause your patient to become anxious. And that's primarily because of the action that it's doing, right? It's causing vasoconstriction, it's causing bronchodilation, it's increasing the capillary permeability to kind of get those fluids to shift back to where they're supposed to be. So just kind of keep all of those things in mind when administering epi. It's a very, very strong and very, very potent drug. This is naloxone, or otherwise known as Narcan. Most people kind of recognize it by the Narcan name. Just keep in mind that naloxone and Narcan are the same medication. This is going to be given to our suspected overdose, opioid overdose patients, for our patients that have that respiratory depression associated with that opioid overdose. Contraindications for it is going to be any type of hypersensitivity. And also, another thing to note is if there's an infant that was born addicted due to the mother's addiction, we don't really want to give it to those patients because it can cause severe withdrawal symptoms for them. Um, Liquid form is what it comes in. We're going to attach that Bristol jet that's on the screen and put that MAD device on top of it to administer the medication to our patient. Basically, what it's going to do is cause it to make like a nice little mist, and we're going to administer the medication IN. This medication can also come in the form of an auto-injector that you can give an IM injection. So kind of keep that in mind. Know the equipment that you have on your unit. The dosage for it is going to be 2 milligrams. We can give it in smaller doses or increments though. So a lot of times we like to start off with zero point 0.4 milligrams and then just kind of work our way up to 2. Um, with children, it's going to be 1 milligram. So same thing for them. Start with that smaller doses and work your way up. Like I said, our goal is to get that respiratory drive back up and running on its own. The action of this medication is that it's going to bind to those opiate receptor cells and stop the narcotic from binding to it, which is going to allow them to get their respiratory drive back. Side effects of this medication is going to be chest pain, nausea, vomiting, irregular heart rate, seizures, and agitation, and possible combativeness. So we want to make sure that whenever we're giving this medication that we're not slamming it on our patient. We're giving it at a nice low rate to try to minimize the side effects that we're getting. So that is the end of our mainline medications that we give to our patients. We also have these other medications that you could potentially give to your patients: ibuprofen, Tylenol, and prolidoxime chloride with atropine. Um, so we're going to go over those just briefly. With ibuprofen, another name for it could be Motrin or Advil. It's an NSAID, a non-steroidal anti-inflammatory drug. It's used to treat pain, fever, and reducing inflammation, right? Things to keep in mind with this drug, it does have antiplatelet aggregating factors, so we don't want to really give it to any patients who have any type of blood clotting problems or if they have some type of GI bleed or ulcer, because it can cause them to bleed. We also do not want to be giving this medication to anybody who has a known allergy or hypersensitivity to the drug. As far as dosage is concerned, kind of refer to your local protocols to figure out exactly what dosage of this medication you should be giving. For Tylenol, we have another name for it is going to be acetaminophen. That is going to be the generic name for Tylenol. So you may see that on some of the bottles. It is used to treat pain relief and to treat fever. Again, this can be used in conjunction with the ibuprofen, alternating between the two, or it can be used in place of it if the patient has a hypersensitivity to ibuprofen. Keep in mind that this medication, if they take too much of it, can cause liver damage. So we want to be mindful of that. If a patient has taken a whole bunch of Tylenol already prior to our arrival, we do not want to be administering them more Tylenol. We also do not want to administer this medication to anybody who has a known allergy or hypersensitivity to this drug. And so for prolidoxime chloride and atropine, it's a cholinergic toxicity antidote. So for instance, if anybody has been exposed to a whole bunch of pesticides, and then there's some other chemical agents, we want to get this medication on board to reverse those effects. So it blocks the parasympathetic nervous system and reverses the effects of cholinergic poisons and drugs. Okay. the atropine in it is going to block the receptor sites and keep the poison from being able to bond to the receptor sites. So this medication is administered in an auto-injector type form. It's called dual-dose sometimes is another name that you may hear from it. Is going to inject both of those drugs through one needle at the same time deep into the muscle. So for the first dose for this medication, it's going to take about 10 to 15 minutes for it to come into effect. If you do see that you need to give additional doses, you're going to administer 2 additional single doses for the second dose. So the same amount of medication that was in that auto injector, but you're going to do it twice and you're going to do it in rapid succession. Um, reach out to your local instructors or look at your local protocols to see if this medication is in there so that you can see the dosages for it.